No pet owner wants their cat to be in pain, but since cats can't tell us when something is wrong, it is up to us to recognize the signs they may give us. If you aren't sure what this looks like, no worries. Here are 19 signs that your cat is crying out for help. Number 19. Increased hiding. Cats like to hide, but if your cat hides more often than usual, it could be a sign that they are in pain. Pets who suddenly start to hide could be stressed out or have an invisible illness wreaking havoc in their body. Number 18. Not using their litter box. If your cat has always used their litter box and then suddenly starts doing its business in random areas of the house, they may be trying to tell you that they don't feel well. Health concerns that can cause litter box issues include urinary tract infection, kidney disease, and bladder stones. Number 17. Changes in maintenance habits. Cats are great at maintaining their appearance. They like nothing more than having a clean, shiny coat and paws that are free of dirt. When your cat starts to neglect their grooming routine, it may be time for a checkup. Your pet could be suffering from a range of ailments that cause fatigue, which would explain their disheveled look or the undoing of their grooming habits. A disheveled cat might be missing patches of fur, have debris stuck in their fur, or have feces stuck to their rear end. Number 16. Discolored gums. Your cat's gums should be a deep pink color, and when you press them with your finger, they should return to pink color within a few seconds after lifting your finger. Gums that lack color are usually a sign of blood loss or poor circulation. This is because gums get their bubblegum pink color from blood flowing beneath the surface. Bluish gums can indicate a life-threatening lack of oxygen. Bright red gums could be a sign of toxicity or overheating, but it can indicate a dental issue if the redness is right above the teeth. Number 15. Stinky breath. Unusually stinky breath in your cat can be a sign of gum disease or tooth decay. A pet's teeth are home to hundreds of bacteria, and you can minimize the risks by brushing their teeth and scheduling an annual dental cleaning. Number 14. Drinking excessive amounts of water. If you notice that your cat seems to be drinking more water than usual, it could be a sign that something is wrong. Cats in general don't drink copious amounts of water, so it should be fairly easy to notice that their water bowl empties quicker. A cat who drinks a lot of water could be suffering from an endocrine problem, such as diabetes or hyperthyroid disease. It can also mean potential kidney disease, which usually starts when cats reach an older age, but can come on prematurely. Number 13. A sudden increase in appetite. Most people worry when their pet stops eating, but a sudden increase in appetite could also be a sign of sickness. An increase in appetite can indicate your cat has underlying health problems and needs to be examined by a vet. Increased appetite can be due to diabetes, hyperthyroidism, or nutrient malabsorption issues. Number 12. Crying or yowling. Crying or yowling can indicate your cat is experiencing some kind of pain. If you start to pet your cat and they whine or keep distance from you, you know there is something wrong. Number 11. Vomiting. Some people believe it's okay for a cat to vomit once a week, but it's not. While vomiting a few times a year or an occasional hairball is normal, vomiting once a week means there is a problem. Your pet could be suffering from some kind of sickness. Number 10. Increased aggression. Sudden changes in a cat's behavior is a sign of sickness. A cat in pain may become aggressive, especially if you unwittingly touch a sore place. Number 9. Losing hair and crusty skin. If you notice excessive loss of hair and crusty or scaly patches on your cat's skin that may be red, a vet visit is necessary. Too much hair loss can be an indication of skin disease, vitamin deficiency, allergy, or an overload of stress. In some cases, these are hallmark signs of ringworm, and it's important your cat visits a vet. Number 8. Unexpected weight gain or weight loss. If your feline is suddenly losing or gaining weight for no obvious reason, it's important to visit a vet. Cats' physiology is different from that of humans. A cat's gaining or losing a single pound is roughly comparable to a human gaining or losing 10 pounds. so make sure to pay attention to small variations in your pet's weight. In older cats, weight loss can be normal as they lose muscle mass, but extreme changes in weight can be a sign of something serious, like cancer. Number 7. Lack of appetite. If your cat has suddenly stopped showing interest in their favorite treat, take a note. A loss of appetite could be a sign of a serious underlying infection, kidney failure, fever, or even cancer. Number 7. Mobility problems. Stiffness or limping can be a sign that something is wrong, especially in a young cat. In older cats, it could indicate arthritis. Number 5. Change in sleeping patterns. If your cat suddenly begins to sleep all day when it used to be active, they may be trying to tell you that they don't feel well. The opposite can also be true if your pet is suddenly up all night, vocalizing, or is overactive during the daytime. It could indicate an underlying issue. Number 4. Coughing. Coughing can be caused by allergies, hairballs, and asthma, to name a few of the more minor inflictions. It can, however, also be caused by more serious conditions like heart disease, lung disease, and other contagious diseases. It could also be a result of respiratory tract problems, with the feline version of bronchitis being one of the most common problems in this category. If coughing persists for more than a day or so, don't wait. Contact your vet. Number 3. Runny eyes and nose. Sneezing, discharge from the nose or eyes, fever, coughing, and sniffles can all be signs of a feline upper respiratory tract disease. This is essentially the equivalent of the common human cold. However, excessively runny eyes or a clear discharge coming from the eyes can mean eye irritation or a clogged tear duct. Green or yellow discharge is likely a sign of infection that requires medication from the local veterinarian. On the other hand, if your cat has eyes that appear red and runny, they might have an issue known as conjunctivitis. In other words, they might have pink eye. Feline pink eye can be caused by dust, an infection, or allergies. It can even come on as a result of feline herpes. Number 2. Bloody urine, stool, or vomit. Blood is never a good thing. In your cat's urine, it can mean a urinary tract disorder. If you notice blood in your cat's stool, it can be indicative of a number of illnesses. Some illnesses that cause bloody stools are relatively minor, while others, like parasitic infections, are much more serious. Now, blood in the vomit is always a bad sign. It always means that there is something seriously wrong and that your cat needs medical attention. Number 1. Trying to use the bathroom. A cat who tries to go potty but isn't producing anything may have a blockage somewhere, which could be life-threatening if it's left untreated. This is especially a concern if the cat seems to be in pain while trying to do its business.